I'm Dr. Maria Rumsey, and I'm one of the cardiologists who founded Club Afib.
And I'm Nitesh Sood, an electrophysiologist and founder of Club Afib.
We're here to talk about atrial fibrillation, Club Afib, and why we started it. The reason we started Club Afib was because we realized that companies like Apple were allowing patients to check their own EKG anytime they wanted. And so patients now who have atrial fibrillation are able to control their own disease because they can actually monitor themselves, and they can tell the doctor how many days they've been in AFib versus how many days they've been normal.
And also, treatment for atrial fibrillation has changed rapidly and dynamically in the last few years, especially in the last 1 year. And we want every patient to have access to the latest up-to-date information on how to manage and treat atrial fibrillation.
When you download the Club Afib app or go to the website, what you'll notice is that there are 4 parts to it. The first part of Club Afib is really a lot of education. So we've written some articles and we have diagrams of the heart and videos explaining what AFib is, how to treat it, and all of the different risk factors or lifestyle modifications that you can do in order to reduce the amount of AFib you have.
Yeah, we really hope that we have done this in a manner, and we've tried really hard to do so, that you can understand the most complex topic in atrial fibrillation explained to you in a very simple format that anybody and everybody can understand.
The second part of the app you'll notice is where you can actually keep track of your EKGs. We've charted your AFib in a calendar format so that you can see which days you have AFib and which days you're normal. And you can show this to your doctor, or you can send him the EKGs right from the app.
The other section is the health categories and atrial fibrillation burden. You can chart your AFib with your alcohol intake, with your sleep, with your exercise, risk factors that can lead to increase or decrease in your AFib burden. So now you can actually monitor these risk factors and change the course of your own atrial fibrillation.
The next section in the Club Afib app is actually a social platform where you can post ideas or thoughts or questions that you have and discuss it with other club members.
So this is a great forum for you to share your experience and learn from others' experience. And if nothing else, it's just nice to have a support group in some ways, where you know that you're not the only person who's managing and going through this disease process.
The other thing about the app is that you have a chat with an expert feature. This is one feature that you can choose to subscribe to if you want to speak to a cardiologist or an electrophysiologist about anything that has to do with atrial fibrillation.
Yeah, patients during a hurried office visit may forget to sometimes ask all their questions. They may not, or they may remember questions after they leave. So this is an opportunity for you to take your time and talk to us about anything and everything about atrial fibrillation that you may have, in discussions about ablation, about medications, about Watchman, pacemakers. This is just an opportunity to sit down calmly and so that we can answer your questions.
We hope that you download the app and that you find it useful and helpful in reducing your AFib.
Yes, and stay in sinus.